Hi, Dr. McSwain here, and I want to talk to you about the functional medicine timeline. So the functional medicine timeline is a tool that allows clinicians like me to visualize your story chronologically by organizing important life events and health issues from preconception to the present. So oftentimes people go into a doctor's office and they check mark, different family history factors like cardiovascular disease and cancer, and then maybe some symptoms that you've had in the past or you're currently experiencing. But it's fairly fragmented. So what the timeline does, and you can see this in the document, is it actually looks at what happened preconception. What was going on, and that's often a lot of family history dynamics. We look for genetics, if there's a consistency and patterns throughout your family that would possibly indicate a genetic predisposition to a problem. And then what was going on when during your while you were pregnant, or while your mother was pregnant, and when you were in utero, what was happening there. And so these are termed together as antecedents, and antecedents are factors that predispose a person to an acute or chronic illness. They can be family history, genetics, and circumstances of birth and delivery. So that is really important understanding, is that antecedents in this grouping can also include up until the delivery. So that's an important consideration, because these are very significant events in your life, and there is a little bit of trauma that we experience as we pass through the birth canal, or of course if people have C-sections, and are born from C-section, that's also very impactful for the rest of your life. So we see that. Then we look at other categories called mediators and triggers. And mediators and triggers, just in a nutshell, a mediator it contributes and it continually manifests disease. So mediators do not necessarily cause disease, but they are your host response. So you can think of, if you were a child and you watched someone get special attention because they were always sick. So then that's a learned behavior that in order to get attention from people, you have to be sick in order to get that attention. Or people who act out in elementary school and they learn the only way they can earn attention is by acting out. So those are examples of mediators. And important in mediators is what is just this ongoing pattern that is present in the timeline of your life, and then kind of build you up to develop a chronic disease or symptoms of a chronic disease. Another category is called triggers, and triggers are basically, I'll give you that, I want you to have the clear definition. So they're events or entities that are discrete and they may provoke symptoms or disease. So, there's a lot of times people talk about a trigger that, they see that and it influences them. So I add to this definition that a trigger is a seemingly neutral item that has a personal memory connection that evokes an emotional response. And so when you evoke an emotional response, you actually can stimulate your mind and your immune system to respond to that. For example, we have a patient in my practice who loves the old doorknobs of an old building, and she always sees them, and they remind her of her grandmother's doorknobs. And when she was growing up at her grandmother's house, this patient of mine called her grandmother's doorknobs diamond doorknobs. And whenever she sees them, she gets really excited, like she's at her grandmother's house. And that's a wonderful thing. Another example of triggers are, and the loop that we tell ourselves over and over, are people when they look at their car and they say, I hate driving, now I have to go to work, and I hate working, and I could be in a car accident, or I have to sit here for hours and I don't get to see my kids because I'm stuck in the car. It's a car, but there's so much emotional connection to that it actually becomes an emotional and immune system trigger, creating chronic stress and activating the immune system that is contributing to chronic disease. There is a study called Adverse Childhood Events, and I want to talk to you about that because it kind of combines mediators and triggers together. But basically, adverse childhood events and the research with this shows that when children have one, possibly two adverse experiences in their life, so let's say the divorce of their parents at a young age, but they're supported by both parents. They're in a stable education environment. They're receiving opportunities that they actually can build resilience from that adverse childhood experience. However, if children are having multiple adverse childhood experiences, so disconnection from a parent with divorce, moving around a lot, violence, be it physical, sexual, emotional, neglect, and struggles with relationships, not sleeping well, having gastrointestinal issues related to poor nutrition foods, all those things are considered adverse childhood experiences, and they actually decrease life expectancy, and they multiple times fold the incidence of having chronic diseases like chronic fatigue syndrome, fibromyalgia, migraines. And so these are adverse childhood experiences, and that's something we take into consideration in the timeline when we look at what's going on with your chronic disease manifestation, or also how you can just help yourself to break from these loops that are contributing to a sense of dis-ease in your body.